Hello, today we're going to talk about lactose intolerance. What is lactose intolerance? Lactose intolerance is the inability to digest lactose in your system. Lactose is commonly found in all dairy products, and patient has different type of complaint. The symptoms are bloating, belching, frequent farting, diarrhea, and sometimes unexplained abdominal pain. Patients go to see their doctors, usually undergo a lot of different tests, and the conclusions you have irritable bowel syndrome. But many irritable bowel syndrome patients actually have lactose intolerance. Lactose intolerance is very common among Asian. Up to 95% of Asian by age 40, they develop lactose intolerance, genetically speaking. It's less common in Hispanic and Black. Up to about 50% of the population have lactose intolerance, and it is less common among Caucasians. Lactose intolerance has become a very common complaint, so the supermarket now carry lactose-free milk, or called lactate milk. It is usually in the blue container and costs a little bit more than the regular milk. How do you diagnose lactose intolerance? Lactose intolerance can be diagnosed by two ways. One, simply avoid all dairy products. In 1 week, all your symptom goes away, then you have lactose intolerance. You can also re-challenge yourself to see if the symptom comes back. Please note, if you're over age 40 and you have abdominal pain, you should still go consult your physicians. If your abdominal pain does not resolve or does not completely resolve. Another way of diagnosing lactose intolerance, you need to go see a doctor and do a lactose challenge test. Lactose challenge test is a test that you drink lactose with C14, which is a radioactive material attached to lactose, and if you digest the lactose, your body will break down the sugar, and when you belch, you'll have the C14 release in your breath. How do you treat lactose intolerance? A simple way is to avoid all dairy products. But if you must eat or drink dairy products, you can go to the drugstore and buy a lactate pill. Lactate pill is over the counter, and you can take between 1 to 4 tablets depending on your symptoms. You have to titrate it to your symptoms and the amount of lactose food that you want to eat. If you eat lots of ice cream or lots of cheese, you may have to take more. If you just have a bite or have a drink of milk, you may get away with just 1 tablet. Thank you for listening. We hope to see you on the air.